Good morning, everyone. Interesting things developing out there, but it'll be cool to see really just where we're going with the numbers. I would like to say this: when it comes to the COVID updates that we give, I'd like to kind of explain one of the reasons why we keep bringing this up. Because when you're looking at how COVID is affecting the economy, it's also reflecting into what's going on with the market. So the more we understand where we are in this COVID battle, the better we understand what we need to do moving forward for our clients from a investment strategy standpoint and from an advanced planning standpoint. So it's something that we feel is important to let you at least understand what we're seeing out there. We do understand the need that clients have for information, and we want to make sure that we get you the accurate information. We also understand there's a lot of fear out there. When you think about fear, a lot of it's propagated by the news. A lot of it's just the unknown, right? What we don't know kind of can put us a little uneasy. Our job is to give you as much information so you can actually relax and understand what's going on out there. And through that relaxed nature, actually have victory in everything that you want to accomplish from a wealth management standpoint. So we're going to take a look at the nuts and bolts of this and really kind of put it together for you. So here's what we have. We're going to start with Michigan. Why do we start with Michigan? Well, because that's where most of our clients are, or at least are from. Let's take a look at where we're at. So on this slide, we show the map of Michigan. It's kind of broken down into 8 different regions, and each one of those regions are designated by a risk level. Now, if anybody knows Brenta Hunter from Hunter CPA, she loves purple, and she would just love the fact that the state of Michigan went from the red and yellow map colors to the purple map colors. One of the reasons was they thought it was conflicting with some of the other maps that they were working with. But here's what we have. We've got 6 different stages. They run from uncontrolled growth down to post-pandemic. In other words, we're open back up again. But the criteria for opening still is not clear. I think we have a better understanding, but it's still not fully clear as to when we're actually going to get to that post-pandemic state. So let's take a look at some of the numbers. First of all, Michigan statewide daily tests over time. If you go back to April 1st, we were 7-day average testing of just shy of 4,000 a day on average. If you fast forward to today, now we have about 29,000 testings that are being done. That's our 7-day average. So that's about 7.4 times more than we had back in April. So as you can imagine, with more tests, are going to come more people being diagnosed. So here's where we are. So the Michigan statewide positive test rate over time has actually dropped 92% from April 1st. I mean, that's huge right there. April 1st, we were at 34.8. Now, why was that? Well, because the test rate was much lower at that time. So the number of people being tested was lower, and it was more the people that absolutely had the virus. Or at least the conditions that made you think they had the virus to be tested. Again, fast forward to today, we're down to 3.2% positive test rate. Again, because we have so many people being tested, there's a lot of people that just aren't sick. So more than just the sick are being tested. Now, we go on to the cases per million over time. This number, again, go back to April, was 128 that were being tested. Now we're at 47.9 is what the 7-day average is. And again, this is the cases per million over time. And when you think about it, on 919 testing, it's up 9.2 times the amount we had in April. So things are going in the right direction there as well. Now, this is probably the most important number, the Michigan statewide death over time. In April, our average was 172. 2 weeks, well, actually 4 weeks ago when I did this update, we were at a 7-day average of 8 deaths. Now we're down to 6. So as you can see, things are getting much, much better. We've actually plateaued since the beginning of July. Things are looking quite up right there. Now, let's take a look at the recap. Again, this is very positive stuff for the state of Michigan. Now, what I'm a little concerned about or confused about is why we're stepping backwards and not moving forward in the risk levels. So if you think about it, the testing is robust at 29K daily average. So that's, again, 7.4 times greater than it was in April. The positive test rate is down to 3.2, so that's a 92% drop in positive tests. The average new cases, the 7-day average is at 47.9, down 63%. And then the average death daily is 6, down 96.5% from the April numbers. So my hat's off, quite frankly, to the health professionals, because they're doing a great job of keeping this under control. We know a lot more about the virus now than we did before. The hospitals are fully capable to be able to take care of the patients. So again, hats off to all the healthcare professionals and everybody that is helping to get this under control. Again, when you look at the decision to open, what it appears is that it is about positive test rates, not number of deaths. But as you could see in the numbers, the positive test rates are coming down to a level that is really containing from what I'm seeing. So I'm not sure why we're not opening up. But the sooner we get the ability to open up, the sooner our economy will start moving. Now, the state of Michigan isn't that much different than the rest of the countries out there. Now, when you look at US and Europe, the US, again, is doing much better. The cases and hospitalizations are continually going down. 90% of the US population is below a transmission rate of 1. And as Rocky had pointed out, anything below 1, you're going to see a decrease in numbers. So it's not exponentially expanding on us. It's going the other direction. That's good. The average fatalities are less than 1,000 over a 7-day, really for the last month for the first time. So that's a good thing. The cases in Texas and Florida have dropped dramatically. And I just want to point something out again. You will have some trends up and down over time, just due to different states opening, pulling back, opening back up again. The ebbs and flows would be a natural progression in opening up our country. Let's go on to Europe. Rocky had mentioned it earlier. Europe's reported cases are up, but very much like Michigan, there is little increase in the fatalities. So yes, there's more people being confirmed. One of the reasons is because they are testing a whole lot more over there than they were back in April. So as you would expect, you would see more confirmed cases. Now, these could be people that have had it already, not just people who are currently going through the healing process relative to it. But again, the fatalities have kind of leveled off, which is a very positive first step here to reopening, actually, the world. So if you think about the next step really is the vaccine. And the current administration has dubbed getting the vaccine out there Operation Warp Speed. And certainly they are moving rather fast to get a vaccine in place. I think that's awesome. There is a question out there as to how many people who will actually take the vaccine. you know, the studies that we've seen or the polls we've seen so far are saying about 50% of the people would take it, and 50% are saying, no, I'm not going to take the vaccine. Some just by nature of they just don't do vaccines in the first place, but others could be that they're just not sure about the vaccine yet. So time will tell on that. But here's some good news. At the end of the day, right now, what the studies are showing is that we've got about 15 to 20% herd immunity at this point. Now, if you listen to any of the studies, you would hear that they want to see us above 60%. Well, if 50% of the country actually gets the vaccine, that could very well put us over that 60% mark, which would put us into clean sailing or relatively clean sailing moving into 2021, which is obviously very good for the economy, very good for the market as a whole.